Hello and welcome to the Anxiety BC website and to this interview on post-traumatic stress disorder. I'm Dr. Michael Catchpole and my guest is Dr. Ram Randhawa. Dr. Randhawa is a psychiatrist at the Anxiety Disorders Clinic at the University of British Columbia. Dr. Randhawa, thanks for doing this.
Thank you for having me, Dr. Catchpole.
Dr. Randhawa, post-traumatic stress disorder, a lot of people have heard about it, but could you explain specifically what we're talking about here?
Absolutely. Post-traumatic stress disorder is an anxiety disorder that sometimes people develop after they've been involved in a traumatic event like a car accident or an assault.
Okay, and it has to be something fairly serious?
It often is, but it doesn't have to be. What seems to be important is the subjective sense of helplessness and horror that people feel when they're in a traumatic event.
Okay, and what kinds of things do they experience?
Well, often what happens after they've been through the trauma itself, in addition to having to deal with the consequences of the trauma, people with PTSD find that they have flashbacks, nightmares. Sometimes they can't stop thinking about the event.
Wow. And in the longer term, does this affect their emotions and so on?
It does, absolutely. What happens is they find it hard to concentrate. Sometimes their sleep is affected. They get angry, they get irritable more readily. And after a while, they start to feel increasingly disconnected with the world. They feel detached.
Okay. For people looking at the website here, what can they do to help themselves?
Well, what people can do to help themselves first is to understand and recognize what post-traumatic stress disorder is, that it's not a failing, it's not a weakness, it is an anxiety disorder that some people develop. And I think one of the most important things is to not judge yourself as a consequence of what you're going through.
So people will say, I'm going crazy, but they're not. This is actually a normal response for a lot of people to an abnormal event?
Very much so, very much so. And learning how to relax, looking at some of the resources that we have online and how to decrease your overall level of anxious arousal can sometimes be very helpful.
Okay. And I also hear exposure, that maybe you could talk about that.
Oh, absolutely. Exposure is a central part of treatment for post-traumatic stress disorder. Often what happens after people have been involved in a traumatic event is that they spend a lot of time and energy trying to avoid things related to the event. For example, if they were involved in a car accident, they may stop driving, or they may, even just being a passenger in a car can be extremely anxiety-provoking for them. And what we do with exposure-based treatments is we encourage people to face their fears in a very gradual and supportive environment.
Okay, and when they're doing that process, their anxiety obviously must go up.
Absolutely. Not only does their anxiety go up, in fact, sometimes after some exposure for a couple of days, people have more anxiety, they have more nightmares, they find their thinking about the event gets even worse. But we encourage them, we give them support, and we encourage them to stick with it and to continue doing the exposure. And eventually what happens is the exposure starts to have its effect and people start to feel more comfortable doing things that they were once avoiding.
Very interesting. Other things people can do, you mentioned relaxing, you mentioned graduated exposure.
Sometimes medications can be very helpful for post-traumatic stress disorder, and antidepressants in particular can be very useful. In fact, if that's something that they're interested in, people can see their family physicians to look at those. But primarily I think that what is most accessible to people is learning about the disorder, doing the exposure, ensuring that you don't get caught in the cycle of avoiding things. Go back and face what you're afraid of facing.
Very helpful. Dr. Randhawa, thank you so much for doing this.
You're very welcome.
My guest has been Dr. Ram Randhawa from the Anxiety Disorders Clinic, where he's a psychiatrist at the University of British Columbia.